All right, let's tackle a topic that's got a ton of assumptions floating around it, the link between testosterone and erectile dysfunction. We all see the commercials and hear about low T, but what's the real story, according to the science? Let's dive in.
So this is the big question, isn't it? If things aren't working quite like they used to, is a dip in testosterone automatically to blame? I mean, it seems like a simple, logical connection, but the science, well, it tells a much more complicated story.
And boom, right out of the gate, we get a fact that might just blow your mind. Hormonal problems, the whole category that low T falls into, are actually one of the rarest causes of ED. Yeah, you heard that right, rarest. That pretty much flips the common narrative completely on its head.
Okay, so if hormones aren't the usual suspect, then what is? To really get a handle on this, we need to zoom out and look at the bigger picture of what's actually going on.
And this chart just says it all, doesn't it? Take a look at that tiny little sliver for hormonal issues. It's next to nothing. The vast majority of cases are rooted in completely different things, mostly problems with blood vessels and nerves, along with other physical and even psychological factors. Hormones are just a tiny piece of a much larger puzzle.
This is why a good doctor isn't just going to look at your hormone levels. They're playing detective, looking for clues in your entire medical history. Things like diabetes, which messes with nerves and blood flow, or obesity, or even certain medications. These are far more common red flags for the real root cause of ED.
Which brings us to a really critical point. What does testosterone actually do for erections? It's not what you might think. We need to talk about what the research calls the threshold effect.
Honestly, this is the perfect way to understand it. Think about the air in a car tire. You absolutely need enough air for the tire to function properly. But once you hit that right pressure, does pumping in more air make the car go faster or handle better? Of course not. Testosterone works in a very similar way for erections.
And this quote from the source material just drives the point home. It says, normal adult testosterone levels are not required for normal erections to occur. Let that sink in for a second. You don't need peak levels for normal function. You just need to be above that minimum threshold.
Now, it is a fact of life that testosterone levels naturally go down as men get older. As you can see here, the amount of free, usable testosterone in a healthy 75-year-old is, on average, about half of what it was when he was 25. That's a significant drop.
But, and this is the crucial part, just because your testosterone goes down and the chances of ED go up with age, it does not mean one causes the other. It's that classic saying, correlation is not causation. For most men, even with this natural decline, their levels stay well above that critical threshold we just talked about.
So how does all this science translate into an actual doctor's office? How do they figure out if a hormonal issue is really the problem? Well, it turns out there's a very clear step-by-step process.
The process is really methodical. They'll start with a screening test, but because your hormone levels can jump around during the day, if it comes back low, the first thing they do is repeat it. If it's still consistently low, then they start to dig deeper, measuring other hormones to pinpoint the source of the problem.
Okay, so what if a true deficiency is found? Is testosterone replacement therapy the magic bullet that so many ads make it out to be? Let's weigh the options, and more importantly, the real-world outcomes.
This is a really key expectation to set. For men who are genuinely diagnosed with low testosterone, therapy can be fantastic for symptoms like low libido, a lack of energy, or mood swings. But, and this is a big but, the research shows it often does not fix the erectile dysfunction. Why? Because the ED was probably caused by something else entirely, like those vascular issues we saw earlier.
For those who are prescribed therapy, it's definitely not a one-size-fits-all deal. There are several ways to get it, from injections every few weeks to daily options that you apply right to your skin, like patches and gels. And each method has its trade-offs, of course. Injections are generally more cost-effective, but they can create these hormonal peaks and valleys that can affect your mood. The patches and gels are more expensive, but they deliver a steadier, more natural level of the hormone, though some people do get skin irritation.
And this is absolutely critical. This therapy isn't for everyone. There are what doctors call absolute contraindications, meaning people who should never take it, like those with a history of prostate or breast cancer. And then there are situations where doctors have to be extremely cautious for conditions like sleep apnea.
What's more, the research notes that having clinically low testosterone is itself associated with a higher risk for cardiovascular problems. So a low T diagnosis isn't just about sexual function. It could be a warning sign,
a marker for other very significant health concerns that need attention.
So let's just zoom out for a second and pull all of this together. What's the main takeaway from this whole deep dive into the science?
This one sentence from the research paper sums it up perfectly. Just because two things are common in the same group of people, in this case aging men, it doesn't mean that one is causing the other. So let's just recap the key takeaways here. Hormonal issues are a rare cause of ED. Testosterone works on that threshold basis. More isn't necessarily better. That age-related decline is totally normal. Testosterone therapy often doesn't fix ED. And finally, just because two conditions exist together doesn't mean they're actually linked.
See, blaming low T is often a huge oversimplification. The real story points toward a much more complex picture of our vascular, neurological, and overall health. And that really leaves us with a bigger question, doesn't it? Instead of just focusing on a single hormone, what's the broader, more holistic conversation we should be having about men's health as a whole?